Paramedic scope of practice. A paramedic is a registered healthcare professional who works autonomously, often in uncontrolled environments, drawing on critical and dynamic decision-making to assess and manage an undifferentiated and unpredictable caseload safely and effectively. They may specialize in clinical practice, education, leadership, or research. Paramedic 4 core competencies. Managing uncertainty. Paramedics are educated and trained to make decisions in complex and high-pressure situations, sometimes in unfamiliar and often unpredictable environments. Regardless of the clinical setting of work, the expertise of the paramedic is managing this clinical uncertainty, and the ability to do this across a broad scope of practice. Broad capabilities. Paramedics are skilled at history-taking, consultation skills, examination and judgment in diagnosis and management across the breadth of physiological, psychological, and social health responses, and often a combination of all of these. This is across the entire lifespan, from newborns to the elderly and those at the end of their life. Gatekeeping clinicians. Paramedic practice takes place predominantly in a time-limited space, where there may be limited formal oversight and staff support. In such a space, paramedics typically act as gatekeepers for patients, delivering treatment and directing any ongoing care needs. Essentially, they initiate the introduction of other practitioners to the patient until the care of the patient is transferred to the relevant specialist. Integrated working. Paramedics are autonomous at the point of registration, but integrated working is a component of paramedic practice. Across all clinical settings, paramedics also work closely with other health and social care professionals, such as, but not limited to, general practitioners, nurses, social prescribers, and pharmacists. Profession-wide and individual scope of practice. In defining the limit of knowledge, skills, and experience which individuals possess in relation to their professional role, a scope of practice must be able to describe the breadth of activities currently carried out by the profession as a whole, as well as the activities undertaken by individual paramedics. Scope of practice is not a list of technical clinical skills or core competencies. Whilst these contribute to the practical capabilities of paramedics, particularly when working in a particular clinical practice role or setting, these do not define scope of practice or level of practice in and of itself. Profession-wide scope of practice sets out the standards for paramedics in its broadest nature. As such, any clinical activity that is undertaken within that definition would fall within the definition of being something a paramedic could potentially undertake, and so would fall within the profession-wide scope of practice. Therefore, undertaking a clinical activity that falls outside of that definition would be deemed to be outside of the paramedic profession-wide scope of practice. Individual scope of practice. An individual scope of practice represents the areas within the profession-wide scope of practice where an individual has the knowledge, skills, and experience to practice lawfully, safely, and effectively. As such, individual scope of practice may be unique and is influenced by career, experience, and development. This scope of practice may change over time as a result of specializing in a particular field of practice, for example in research or primary care. Subscribe to the channel for more.